everyone. My name is Henna and I'm a senior psychology student, and this year I have the pleasure of working with Dr. Carly McMorris and Dr. Brianne Redquest to complete my honors thesis. And my research explores the mental health benefits of physical activity for youth with neurodevelopmental disabilities. For this presentation, I will be referring to neurodevelopmental disabilities as NDDs. NDDs are neurologically based conditions that affect how your brain functions. Some examples of NDDs include attention deficit and hyperactivity disorder, autism spectrum disorder, and fetal alcohol spectrum disorder. It is well established that youth with NDDs are at a heightened risk for experiencing mental health issues compared to those without NDDs, with mental health issues such as anxiety and depression affecting 50 to 90% of these youth. If left untreated, the presence of these mental health issues can negatively impact their academic functioning, employment, and can even lead to premature mortality. These youth also experience difficulty in forming close social connections. Yet, despite this, accessible and disabilities-informed mental health supports for youth with NDDs are lacking and under-researched. Because of the prevalence of mental health struggles, it's important we identify factors that improve the mental health of youth with NDDs. One of these factors is physical activity. Sedentary behavior, such as increased screen time and lack of physical activity, is strongly associated with poor mental health issues among youth, and findings have shown that youth with NDDs lead more sedentary lives compared to their peers without NDDs. Although limited, there is research to suggest that children with NDDs who engage in physical activity report physical health and mental health benefits, as shown on the slide here, along with additional benefits that include improved social skills and a sense of belonging. Now, despite evidence showing that youth with NDDs are at a heightened risk for mental health issues and lead sedentary lives, along with the documented benefits of physical activity, the link between physical activity and mental health is largely understudied in youth with NDDs. And my research will attempt to bridge this gap. This research project will explore how these physical activity experiences impact the mental health and social connections for youth with NDDs, and we will do this using a qualitative and patient engagement approach. My research will address the following questions. First, does physical activity impact the mental health of youth with NDDs? Second, what are the secondary impacts of physical activity on social connections? And we hypothesize that physical activity experiences will improve the mental health and promote social connections among these youth with NDDs. Lastly, we will also explore what recommendations youth with NDDs have for other youth with NDDs struggling with mental health. Most notably, this research will employ a patient engagement approach. Patient engagement in research is an approach that involves meaningful collaborations with people who bring the collective voice of specific affected communities. For this study, we are engaging in this approach by collaborating with an individual with NDDs. This advisor has assisted in the development of the data collection tools to ensure these tools are relevant and accessible for youth with NDDs, and will also assist in the data analysis and knowledge translation efforts, which I will discuss next. Participants will be recruited through NDD-specific agencies such as Special Olympics Canada and CAN FASD. Eligible participants will be youth between the ages of 15 to 24 with a neurodevelopmental disability and those who engage in any form of physical activity. Once recruited, these youth will participate in one-on-one semi-structured interviews about an hour in length. Now I'll go into a bit more depth about the content and structure of these interviews. These interviews will be sectioned into 4 topics. First, these interviews will inquire about the physical activity experiences of these youth, and then focus on how these experiences have impacted their mental health. Third, we will also explore how physical activity has impacted their social connections with peers and coaches. And lastly, any recommendations these youth might have for other youth with NDDs and how to support their mental health. Once these interviews have been conducted, they will be transcribed verbatim and analyzed using thematic analysis. We will identify common themes and sub-themes within the interviews and then use researcher triangulation, which is the process of using 2 or more researchers on the project to share the themes they have identified to ensure internal validity. Through this work, I will fill a gap within current literature by establishing the association between physical activity and mental health in youth with NDDs. Most importantly, the findings will inform strategies to promote physical activity among this population, which in turn will increase their mental health and enhance their overall quality of life. All knowledge translation efforts will be done alongside the advisor and will include infographics, community presentations to youth with NDDs and their families, and professional presentations. Overall, this study hopes to make a real-life impact through informing strategies and initiatives that will promote the mental health of youth with NDDs. And I would also like to thank my supervisors, Dr. Carly McMorris and Dr. Brianne Redquest, for their mentorship and guidance, along with the Enhanced Lab team. I would also like to thank the Alberta Children's Research Institute. Thank you.